At the Administration for Children and Families, or ACF, within the U.S. Department of Health and Human Services, we're supporting the mental health and well-being of children, youth, and families across the country. We spoke to young people and families to hear about their experiences accessing and receiving mental health care. They shared insights and tips from mental health professionals about creating opportunities to provide supportive and affirming care that empowers both young people and their families to be actively involved in their treatment plan. Supportive care for the whole family. Tips for mental health professionals. Find ways to build rapport.
There were specific moments where I feel like I saw a therapist make the effort to connect with me. I feel like there was moments where a therapist would just create a moment where I felt like it was okay to open up, even if it wasn't directly about, what brought me to therapy. I remember there was therapists that made me feel like I had an opinion, even if it was on something small. I remember therapists that would sit there and scribble on their notebook endlessly, and I never get a glance at that mysterious notebook. But I also remember therapists that let me thumb through my own notes. I saw what they were writing. Like, I remember therapists that tried to make me feel comfortable.
The best counselor, she was a Black woman wearing natural hair. The space was familiar. There was some similarities. That relationship with that counselor that my daughter felt matched with, that felt compatible, that resonated with her, that person was able to get so much work done with my daughter around who she is and how she felt about herself in the world. So take the time to really connect to the person. The first part is connecting with the person and making sure as a professional that you have opened up your space, that your space is inviting, that the people that you serve as a mental health professional feel good when they're in your space.
Provide affirming care.
Have some sort of signal that this is going to be affirming. When I'm reading who you are, I want to see your pronouns. Once we're talking and meeting in person, introducing yourself with pronouns, listening to my affirming name and my pronouns, and then using them, right? And even if you make a mistake, which is okay, we all make mistakes, knowing how to appropriately apologize, move on, and correct in the moment is so pivotal. I think my key message is you don't need to understand someone's lived experience. A matter of fact, I think you should expect not to understand someone's lived experience in order to listen to them, in order to affirm and respect them, and in order to validate them. Is my patient, is my youth, is my family, is my client, right, dictating this process? Do I have it in their own words what their struggle is, what their crisis is, what they need help with? Do I have it in their own words what they want to achieve, what that end goal is? And if I don't, I think I need to rethink the process.
Listening is key.
So when we're thinking about what makes a good mental and behavioral health clinician, in particularly when we're talking about young people, I'm going to use the L word and I'm going to say listen, but it's a different type of listen. As an adult, I feel like it's kind of like the standard, like people expect that, yeah, that's why you're there, to be heard, to be listened to. But for young people, in particularly minors, folks who are under 18, oftentimes they're turning to the parent, they're turning to the caregiver. In order to do this work, you have to actually center the person who is seeking help, no matter what their age is. If someone walks in and they're 17 years old, right, and they're looking for help, that's the person you listen to. That's the person who has that agency to self-identify what their crisis is, what they need help navigating, and what that goal is that they want to achieve. And that is the person that needs to lead the process.
Consider the whole person.
I think going in, just remembering that there's other things involved. It's just not one set cause of what's going on. I know that Uvalde, we had this tragedy happen, and a lot of times, whenever there was counseling involved, they would jump straight to that, and I think they need to go back a little bit more and remember that it's not only that tragedy that can cause these type of issues or anxieties in these children. It could stem from something else. So just be open to exploring every aspect of someone's life, so that way they can treat everything in a holistic manner.
Identify where to engage family.
Thinking about talking with mental health professionals and what it's like as a parent to bring my child who's experiencing challenges to them and say, help us. I need professionals to understand that we are a whole unit. There's a past to where we are now. And there's a past of that child, there's a past of that parent, there's a past of the family collective, and even bigger sense, there's a past of historical, structural trauma. And those are real things that folks like me have to contend when we step into these places and we say, mental health professional, see me, help me.
If we're dealing for folks who are dealing with trauma, particularly trauma tied to abandonment, to child welfare, to all of these things, that being careful with our language, making sure we're being broad. When we say families, we mean friends, people who love us, supporters, grandparents, parents, foster families, all of those people who are in our life to support us. That is who we should be including in that conversation, right? We need to shy away from biological parents being the only thing that equals family. So honoring those folks who love and care and support someone, like that's the true definition of family, right? It doesn't just mean blood. It means who is gonna love and support you and help guide you.
If you or someone you know is struggling or in crisis, help is available. Call or text 988 or chat at 988lifeline.org. To learn how to get support, visit findsupport.gov. To find out more about ACF's mission, impact, programs, and behavioral health work, visit acf.hhs.gov/behavioral-health. This video was developed in partnership with youth.gov.